Welcome to this weekly National COVID-19 update. My name is Dr. Agnes Mahomva, Chief Coordinator for the National Response to COVID-19 Pandemic. Today I have Mr. Noble Mahomva supporting us on sign language. Globally, there has been a sharp increase in the total number of reported new COVID-19 cases during this past week. The majority of these cases were reported in Europe and America. South Africa registered the largest percentage of all reported new cases within the Africa region. Zimbabwe has not been spared by this new phenomenon. This week, Zimbabwe recorded an increase in the total number of new cases compared to last week. This has brought our total number of confirmed cases to over 8,200 since the epidemic started here in Zimbabwe in March 2020, with a recovery rate of 94%. The increase in new cases that Zimbabwe recorded this week is of great concern. It is a clear sign that the epidemic is not over yet and that it can easily spiral into a big second wave. The increase in new cases that Zimbabwe recorded this week is really of great concern. It is a clear sign that the epidemic is not over yet and that it can easily spiral into a big second wave. The fact that Zimbabwe has recorded very good recovery rates does not mean that you, the individual, are not at risk. A recent survey showed that only 25% of Zimbabweans see themselves as personally at risk for catching COVID-19. This very low risk perception is a big concern, as it has contributed to the low adherence to recommended preventative measures that we are observing in our communities. This has in turn also contributed to the increase in the number of locally transmitted cases, as we have just seen this week. Let us therefore wash our hands with soap and running water, wear our mask properly, continue to social distance. COVID-19 is a serious disease and a danger to you, the individual. The increase in the number of new cases in several other countries has also increased Zimbabwe's risk of importing new cases. Today, I would therefore like to talk a bit more about our ports of entry with a focus on a number of questions that you, including our international travelers, have frequently asked. How can we minimize risk of importing COVID-19 cases from those high-risk countries where a sharp increase in number of new cases has been recorded, for example? What exactly is a PCR COVID-19 free certificate? What is the difference between quarantine and isolation? And is the quarantine period still 14 days for travelers coming from those high-risk destinations now that we have local transmission? First, on the risk of importing new cases, we can minimize this risk. We urge you, the individuals and communities, to be vigilant, support and encourage relatives, neighbors, friends returning to Zimbabwe, and encourage them to adhere to the recommended quarantine and isolation guidelines, as well as all the other COVID-19 regulations that you are also observing. Government, working with private laboratories, is providing COVID-19 testing at all the 3 international airports and aiming to make sure that you get your results within 2 hours. This allows us to strengthen the nation's ability to appropriately isolate or quarantine and of course follow up those individuals and hence reduce the risk of importing new cases from those high-risk countries. Another way of minimizing the risk of importing new cases is through strengthening the management of our ports of entry. Monitoring and support visits to all the ports of entry by the task force teams are in progress. Port health officers working very closely with immigration officers and our law enforcement officers are on standby at all our ports of entry, providing support to arriving travelers in line with our national standard operating procedures, our guidelines on testing and on COVID-19 free certificate requirements, for example. So what exactly is a PCR COVID-19 free certificate? It is a COVID-19 negative laboratory test result issued as a COVID-19 free certificate by a recognized testing facility using what we call a polymerase chain reaction or PCR test. Travelers are being asked to have this test done before they travel to Zimbabwe. PCR COVID-19 testing is, however, also available at our international airports. As mentioned before, travelers presenting with COVID-19 signs and symptoms are required to have a repeat PCR test at the ports of entry on arrival, regardless of whether they're having arrived with a negative PCR test certificate, for example. In other words, if you have signs and symptoms, you must be retested. Travelers presenting with a COVID-19 free certificate or testing negative for COVID-19 at our ports of entry are released to quarantine at home. On the other hand, a traveler who gets retested at a port of entry and is found to be positive for COVID-19, they are instructed to isolate until they recover. So what is the difference between quarantine and isolation? Well, isolation means separating people who are PCR confirmed and having COVID-19, or who are clinically confirmed as having COVID-19. In other words, people who have the disease, separated from people who do not have the disease. Quarantine, on the other hand, means separating and restricting the movement of people who are exposed to COVID-19 to see if they become positive or become sick with the disease. This helps us ensure that these individuals do not spread the virus to others. So you have also asked, has the quarantine period changed? Any quarantine should be in place for the duration of the incubation period of the infectious disease of concern. In this case, we're talking COVID-19, and the incubation period for COVID-19 is up to 14 days. And that is from the last time an individual was exposed to a confirmed COVID-19 case. The quarantine period in Zimbabwe, therefore, remains 14 days. What has, however, changed is that travelers with the PCR COVID-19 free certificates are released to complete their quarantine period at home. Finally, let me take this opportunity to remind us all that a second COVID-19 epidemic wave is not an option for Zimbabwe. We don't want it. Let us therefore roll up our sleeves and get to work. The best way to control the spread of this virus and avoid a second wave is to strictly adhere to all the recommended preventative measures at all times, in all places, including at our ports of entry. We are saying social distance at least 1 to 2 meters apart when in queues, at ports of entry, banks, supermarkets, you name it. We are saying wear your mask properly, cover your nose and mouth. We are also saying please wash your hands with soap and running water as frequently as you can, or sanitize with a sanitizer. Your active participation in this national response is very vital. Do therefore tune in to ZTV, the radio, and other media platforms for the most recent weekly national COVID-19 update. I thank you.